And welcome back to the show. Care for the Homeless has consistently delivered essential medical, mental, and behavioral health care to people experiencing homelessness in New York City since the year 1985. Now, CFH currently operates 27 healthcare delivery sites throughout the 5 boroughs, and sharing with us now and sharing the conversation, we're pleased to have the Communications and Marketing Administrator at Care for the Homeless, Connor T. Moriarty. And Connor, good to have you with us.
Thank you, Darren. Thank you for having me.
And congratulations on the work that you guys continue to do really in caring for the homeless. I know that particularly during this COVID pandemic, a lot more work for you has particularly increased. But talk to us about how you've seen things with regards to the homeless community, particularly as we're trying to navigate through this pandemic.
So throughout the pandemic, we did not lay off a single employee. We never closed our doors. We consistently continued to deliver the services that you just outlined, in addition to, adjusting to having some of our residents in our shelters move into hotels, and kind of meeting those changes head on, because, the world, kind of closed down for a little bit there, but we were not able to do that. We had to keep up. And so in addition to, kind of adjusting to those changes, we also significantly increased our telehealth capabilities. So, obviously in the beginning of the pandemic, a lot of people were wary of coming into in-person medical visits. So being able to continue providing care for people via telemedicine was a huge step for us. And then, stepping up and getting our providers equipped with PPE equipment and all other safety precautions was a huge step towards, keeping us in line and ensuring that, we're still able to deliver care to, our neighbors that need it most.
Yeah. And so I want to get a chance for our viewers to know a little bit about some of the work that you're doing in terms of providing those services. So when we talk about providing services, give us an idea of some of the things that you're able to do for those in the homeless community.
Well, Darren, the main thing that we envision ourselves doing is breaking down the barriers to healthcare. Unfortunately, homelessness often carries with it a pretty ugly stigma, where we always say that homelessness is a condition and not a characteristic. I think the stigma has to do with people seeing homelessness as something that's intrinsic with the person that's experiencing it, and we view it as a condition. Conditions are treatable. Homelessness is not something that defines the person that's experiencing it. And no one should be denied basic essential services because they don't have a home. And so the way that we break down those barriers, very multiple ways. Co-location. So all of our health centers are co-located in either shelters, soup kitchens, or other areas where people who experience homelessness often congregate. And that makes it much easier for those folks to access the services. It makes it much easier for us and people on our end to reach those folks and let them know that the services are available to them. And kind of jumping off of that, in early 2020, late 2019, we opened Junia Street, which is our first community-based health center in Brownsville, Brooklyn. That is so community-based health center, that is a freestanding health center, so not co-located with another one, even though it is next to a supportive housing complex run by Women in Need, WIN, who's a partner site of ours. But this is a freestanding health center, so anybody from the community can, take advantage of the services. And it's what Darren, you and I would view as a traditional doctor's office. We believe that the quality of care that we provide is, equal to or better than what, you and I would expect from our doctors. And so kind of breaking down those barriers and, getting these services out to communities that are traditionally very underserved, and who might not even know that the services are available, is a big way that we're able to have an effect on those that we work with.
Yeah, well, I want us to take a look at some statistics that I have here. And I think it's important to note, because when we talk about how the homeless population is affected, We understand the death rate of homeless persons is 3 to 4 times higher than the
Mhm.
general population. Understanding that homeless children also have an increased risk for depression, attention deficit disorder, even like tooth decay, poor school performance. And then also, we see that homeless persons in New York City also suffer from mental illness at 3 times the rate of general population. And these statistics are really startling, but at the same time, it demonstrates an intense need.
That's absolutely right. It definitely illustrates the need for services like the ones that we provide. Um, and it also ties into the fact that our providers, their responsibilities kind of extend past their job description. Um, if, we believe that if someone comes into your office and you give them, a basic health screening, you give them a checkup, basic physical, but you don't really reach them and they feel disregarded while they're in your office, we really haven't done our job because homelessness is so much more than, the physical ailments that people come with. There is even a basic trauma that's associated with just being homeless. And it has nothing, the trauma doesn't have to be some intense emotional pain from their past or something like that, even though that is somewhat common. So our providers are very in tune with addressing those traumas. So that has to do with building trust. Unfortunately, I talked about that stigma earlier. Um, People who experience homelessness have often had negative experiences with traditional medical settings. And so our providers try to offset that by building trust with them, listening to them when they have something to talk about, making them feel heard, making them feel like they're participating in the process of their healthcare. And building that core relationship is a big way that we try to, address those stigmas. Like I said before, close those barriers and try to meet those statistics, head on.
Yeah. And you have a women's shelter, Susan's Place. Briefly give us a little description as to what takes place there.
So Susan's Place is our first shelter that was built in 2008. It is named for our first executive director, Susan Nybacher. She sadly passed away in 2004 uh, before the shelter was able to be finished. But she was kind of the first person to really bring about that co-location model that has been so successful and that has kind of become a standard for health centers and shelters throughout New York City. Um, but we care for medically ill and medically frail and mentally ill women there. And it also serves as another location for one of our open access health centers. Women there can not only some women are not only able to access healthcare and the shelter services, but there's also housing services. Um, Over the past 12, 14 years that Susan's Place has been open, the housing specialist team has typically been able to house 100 women per year. So that's, well over 1,200 women that have been housed permanently since Susan's Place opened. So it's a wide variety of services. And it's a model that we've kind of we've tried to replicate over time.
Yeah. Before we go, I want to get an opportunity to have you share with us how volunteers can be a part of your organization, because we know that a lot of the work that you do really depends on volunteers. So if a person wants to volunteer, what's the process?
So right now we are still kind of holding off on doing in-person volunteer events, but our website and our social media accounts are a great way to check in to see when those resume. But in the meantime, we are always hosting in-kind drives. So in-kind drive, that is a drive where you can either donate yourself or you can host a drive amongst your friends and family, community to collect basic essential items, toiletries. Uh, we usually get a big influx of winter hats and scarves. Socks are always in high demand. So donating items like that is always a huge help. And also donating money. There is within the donation tab on our website, folks can designate what area of our work they would like to see put their money towards. And that can be women, children, etc. And like I said before, check back on our website and follow us on our social media accounts to keep track of what we're doing.
Well, Connor, great work, and thank you so much for the work that goes on there. And I know that especially in a time like this during the winter months, much needed. Thank you so much for being with us, Connor Moriarty.
Thank you, Darren. I appreciate you guys having me on.
All righty. Well, I want to let you know if you want more information, please go to the website careforthehomeless.org, and then you can also follow them on social media at CFHNYC. We do have more shows. Stay with us. Open is continuing right after this.